Hello, and thank you for joining us for this program on oral cancer. My name is Dr. Pam Van Arsdell, and I am a professor at the University of Kentucky College of Dentistry. I'd like to talk with you a little bit more about oral cancer today. About a year ago, I was joined by a colleague, Dr. Molly Smith, and she and I talked a little bit about our grant on oral cancer in Pike County. And this is really just a follow-up to that program. I have a little bit more information for you. And actually, I have a nice solution for us today. So it's okay to talk about problems. We need to know what problems exist, but it's always wonderful when we have an effective solution to a problem. And so we're going to talk a little bit about an effective solution to the problem of oral cancer today. So if we're going to go to the next slide here, I want to just remind you a little bit about what we talked about during the last program, and that is about our grant. The name of our grant is Eradicate Oral Cancer in Eastern Kentucky. This grant is funded by the United Health Foundation, and the University of Kentucky College of Dentistry is carrying out this project in Pike, Harlan, and Letcher counties in collaboration with the county health departments in those three counties. This is the most current data I can find on the rates of oral cancer in the United States. Unfortunately, Kentucky is number one in rates of oral and oropharyngeal cancer in the United States. And you can see here that there are some states that have very high rates. This is specifically for the 65 and under population, but you can see Pike County, and there are some other Eastern Kentucky counties that are indicated in red here, which the red shows that these are the highest levels in the state. So I want to talk a little bit now about our project goals. So these are some of the things we're trying to accomplish with our grant, our oral cancer grant. We want to conduct oral cancer screenings, and we have done nearly 2,000 of those before COVID hit. So we're really unable to do big screening events now. But the idea there was to find oral cancer cases and to get them, those individuals, if we found oral cancer, to get them into care as quickly as possible and treated as quickly as possible. And really the second goal of the project is to educate, to reduce rates of oral cancer in Kentucky, specifically Eastern Kentucky, by educating about the risk factors and things that can be done to decrease the risk of oral cancer. And that's one of the reasons that I'm here with you again today. So the main messages in that campaign, we are encouraging everyone to get an annual professional oral cancer screening. So this is something that can be done at your dental office. Many other healthcare professionals, primary care providers, oral surgeons, can do this as well. We're also encouraging oral self-exams. So there's other self-exams that we are supposed to do that the experts recommend that we do every month. And the American Association of Oral and Maxillofacial Surgeons recommends that all adults, everyone 18 and older, should look in their own mouth every month for signs of oral cancer. And we talked a little bit about what that might look like last time. Things like a sore that doesn't heal, white areas or red areas, swellings, lumps, things like that. So if you find anything, if you do your monthly self-exam and find anything, that should be reported to your physician or your primary care provider or your dentist as soon as possible. And then another thing we're really trying to communicate to the public are the main causes of oral cancer. So the main cause of oral cancer in the front part of the mouth is tobacco. So tobacco use is really the number one cause if you're talking about the front part of the oral cavity or the front part of the mouth. Excessive alcohol use is another one of the main causes, and if you combine those two together, the risk really goes up. So if you're smoking and drinking at the same time, that's very risky. What we want to talk about today is the human papillomavirus, sometimes called HPV. HPV is responsible for most cancers in the back portion of the mouth. So that's called the oral pharyngeal area, or the oral and throat area of the mouth. So we want to talk about HPV today in terms of some of the things that we can do to reduce the risk. These are the areas in the mouth that are at most risk of getting infected with HPV cancer, and that is tonsils, the base of the tongue, which is just the part of your tongue that is furthest back towards the throat, and then the throat itself. So these are the parts of the mouth that are most vulnerable to have HPV-related cancer. So here are some common signs and symptoms of HPV-associated oral or throat cancer. So it'd be a sore throat that doesn't go away, change in the voice, difficulty swallowing or moving the tongue, difficulty opening the mouth wide, a lump on the neck, or an earache. So unlike cancer, oral cancer in the front of the mouth, where we're really looking for a sore that hasn't healed for 2 or 3 weeks, we're looking for a white area or a red area, a large swelling, something like that. HPV-associated oral or throat cancer is a bit more difficult to detect. There's not really a good screening exam for this because you can't really see a change in the voice. It's just something that your patient has to tell you about. You would have to detect this change and report it to your healthcare provider. So it's very important that if you do experience any of these symptoms, that they need to be reported. Obviously, a sore throat can be many different things. In this case, it's a sore throat that lingers. It just doesn't go away. An earache obviously could be a number of different things, but these are things that need to be reported and checked into, because we know that the sooner, it's just like with any other cancer, the sooner you get into care, the greater the chance you have of surviving and the better your outcomes. So what is the standard treatment for cancers in this area? So we're talking now about that oropharyngeal area, or the oral throat area of the mouth that is most commonly affected by HPV-related cancers. So this is typically would be surgery, radiation, and chemotherapy would be the treatments for cancers in this area. The side effects of treatment, obviously if you're familiar with cancer treatment, you know that nausea can be a problem, and that would be a problem with the treatments for oral throat cancer as well. But also because the mouth is the target of the therapy, there are potentially long-lasting problems with swallowing and eating. There can be problems with speech, obviously because we use our mouth to speak. Difficulty in opening the mouth, loss of taste. Some patients require feeding tubes. Some patients require tracheostomies, which is an opening in the neck to help them breathe. And then a chronic dry mouth, which doesn't sound like such a bad side effect, but it can be really devastating. Can make the mouth extremely sore and can cause a lot of sores in the mouth, and also can lead to rampant tooth decay. So a dry mouth is a perfect environment for a mouth full of cavities. So even in someone that's had wonderful oral hygiene their whole life, they can have this dry mouth and then get a lot of cavities, which can also be devastating. So now I want to talk a little bit about oral pharyngeal cancers or oral throat cancers and how they compare with cervical cancers. So you may not be familiar with human papillomavirus at all. You may have never heard of it. It's actually very common. About 80% of the population has been exposed to some type of HPV or human papillomavirus in their lifetime. There's just a few strains that cause cancer. And the two most common types of cancer caused by HPV are cervical cancer, which of course is exclusively in females, and then oral and throat cancer, which can be in either males or females. We now know that oral and throat cancer is the most common type of HPV-related cancer in the United States today. It used to be that it was cervical and that was of more concern, and it's still of concern. But we now know that the rates, and here in this diagram, the solid line, which is, if you're looking from left to right, this is from 1999 through 2015, the solid blue line is coming down over time. So this is representing the incidence of cervical cancer, while the dotted line represents oral throat cancer, and that is going up. It's going up over time. So we are still seeing an increase in oral and throat cancers. And you can see here that the oral and throat cancers now are the most common HPV-related cancer that we have in the United States. I also wanted to mention that men are almost 4 times more likely to be diagnosed with HPV-related oral throat cancer than women. So women can still get this type of cancer, but it's much less likely. Men are 3 to 4 times more likely to be diagnosed with oral throat cancer that is caused by HPV. And this is a disturbing statistic. Kentucky has the highest rate of HPV-related cancers. So that's all cancers that are caused by HPV. We also have the highest rate of oral cancer in Kentucky, and death rates for HPV-related cancers are higher in Appalachia, Kentucky than in the rest of Kentucky. So what that tells me is we have some work to do in Kentucky, and we have some work to do in eastern Kentucky. So what can we do about this? Well, we have worked on risk factors for the anterior portion of the mouth. At the beginning of the presentation, I shared with you cancers in the front part of the mouth are the most common causes tobacco. So we've talked and we have created a lot of resources to help people stop smoking and stop other forms of tobacco. That's a very hard thing to give up. It's a very difficult addiction. We still need to fight that fight and still need to try to quit smoking and stop tobacco, not only for the sake of preventing oral and oral throat cancer, but also because it's would be probably the single most important thing you could do for your health overall. But in terms of the back of the mouth, we know the #1 cause of cancer in the posterior or the back of the oral cavity and in the throat, that's caused by HPV, and we have a vaccine for that. So that's the great news is we actually have a vaccine that has been shown to be, the CDC estimates 92% effective against cancers caused by HPV. So while it is difficult to give up smoking, it is a much less difficult thing to get a vaccine. So we wanted to make sure that everyone knew that there is a vaccine available that the CDC estimates could prevent 92% of HPV-related cancers, and that includes oral and throat cancers. We have 2 wonderful guests joining us today who are experts in the area of HPV vaccination. Dr. Emily Messerly is a nurse practitioner and is an immunization branch manager for the Kentucky Department of Public Health. She is also a staff member at the University of Kentucky College of Public Health. Stephanie Bentley is the nurse administrator at the Pike County Health Department and has been working with them for approximately 20 years. So many of you watching may know Stephanie and may have visited her at the Pike County Health Department. So thank you to both of our guests for joining us. We certainly appreciate you sharing your expertise with us on the program today.
So I just have a few questions for both of our guest experts today. I wanted to ask Emily a little bit about the HPV virus and how common it is. Like
HPV virus is so common that most people don't even know that they have it. I actually have given talks before to groups of teenagers, and I will have about every eighth one of them stand up because 1 in 8 of them has the HPV cancer or the HPV virus that can cause cancer.
Wow. So it's pretty prevalent,
Yeah.
even at a younger age. So I guess my next question was, is it true that many people will never know they've been infected with HPV?
Many people have the virus and have no symptoms, and their body just clears it within a few years. So oftentimes you are totally without symptoms.
So there are many different strains of the human papillomavirus, and some of these strains cause no problems. My understanding is there's approximately 200 strains, but there are some strains that cause cancer. Can you tell us a little bit about those strains?
Yes, yes. There are actually 2 specifically that cause the majority of cervical cancer cases, but there are a total of 9 that the vaccine covers, and 7 of those actually cause cancers. The majority are caused by 2, the cervical cancers, but then the other 5 cause all the other cancers, including oral cancer, that the HPV virus can cause.
There has been much research on the effectiveness and safety of the HPV vaccine. Is there good evidence that the HPV vaccine does protect against HPV-related cancer?
Yes, the vaccine is over 90% effective. This vaccine is along the lines of other childhood vaccines like measles and chickenpox in its effectiveness, over 90% effective. I did fail to mention on the last question that actually the HPV is thought to cause 70% of oral cancers specifically. I mentioned cervical cancer, but 70% of oral cancers are HPV related.
In what year did the HPV vaccinations begin? So this is not a new vaccine.
Oh no, it's been around since 2006, actually. It was FDA approved in 2006. So it's been around for almost 15 years.
Do we know how many vaccinations have been safely given since HPV vaccinations began?
Oh, there have worldwide, I don't know the exact number, but worldwide there have been millions of vaccines given with very low side effects. In fact, I love to quote that in Australia specifically, they have nearly eradicated cervical cancer in Australia because of a nationwide program to vaccinate young women, young girls with the HPV vaccine. So it's been very safe and very effective.
The recommended age for the HPV vaccine is 11 or 12 years old. I have read that this is because this is the time when the body mounts the immune response. So this would make this the best age for the vaccine to be the most effective. Could you talk a little bit about that? Is that true?
Sure, yes, that is true. Originally, when the vaccine came out, it was given as 3 doses. And just a few years ago, they changed the dosing from 3 doses to 2, because in other countries across the world, in Europe and Australia, they had done studies to show that 2 doses give as good, if not better, an immune response at a younger age. So there is plenty of research and data to show that the younger you are when you receive the just 2 doses, your body's immune response is stronger. I often liken this to think about when your baby, if you're a parent, when your child was 0 to 2 years old, how many vaccines did they receive in those first 2 years of their lives? That's because we know the younger your immune system is, the stronger the responses that it creates.
So I have a question now for Stephanie. Stephanie, are people able to get vaccinated if they want it, the health department?
Yeah, our office keeps the HPV vaccine in stock. We can give that to people who don't have insurance, people who have insurance. So we have a variety of ways to get that in the arms of people in our community that need it.
Do they need an appointment to get the vaccine? How would they sign up for that if they wanted to do that?
We are doing appointments now since the pandemic to make sure that everyone can social distance and our clinics are not overrun. So as of now, we are doing appointments only, and they can call the health department here in Pikeville and request and stuff that vaccine, and then they'll go ahead and they'll set them up an appointment. The good part about it is we try to do same day scheduling as well. So if they call early in the morning on that day that they want the vaccine, we can usually put them on the schedule for that same day.
And they will, if they're 11 or 12, my understanding is they'll need that second dose. So what's a good way for parents to remember, or is there a reminder, or what's the best way for parents to remember to get their child back in? I think it's 6 months later.
While they're in the office, our nurses try to encourage people, especially parents, to go ahead and put it in their phones while they're there as a reminder. So that way they'll know that it's time. We also have been able to get some reminders that stick on the refrigerator from the company that actually makes the vaccine. And so we give those out and it's automatically set. You just push a button and then they put it on the refrigerator and it'll start beeping on the day that it's due. So there's a couple of different things that we can do as a reminder. We can also, in the past, we've sent out recall reminders to the patients who have come into our office. And it's like on a little postcard that they'll get, and it tells them to call the health department that they're due for an update on their immunizations.
Gotcha. So did you mention what it cost? Did you say that is it provided at no cost, or does it depend on your insurance coverage?
It depends on, with private insurance, it depends on if the health department is in your network. So we ask people before, they come in and stuff, just to make sure that the local health department is in their network. Most insurance private will go ahead and pay for it. For children from birth all the way up to through the age of 18, we have the Vaccines for Children program. So that covers all the vaccines, and it's for the uninsured, Medicaid, and Native American, and I think it's Alaskan, they can get that vaccine. And the vaccine basically is for free. We charge an administration fee, and that is based on your income. And so it's done on a sliding fee scale. So it may just be a few dollars that you'll have to pay for that vaccine with the children. And once you are out of age for the Vaccines for Children program, then the state also has the adult program, and it supplies us with vaccines for uninsured adults. So there's really no reason why anyone wouldn't be able to come and get the vaccine here at our office for a very small minimal fee.
Gotcha. So Emily, just kind of moving from that conversation back to you, what about the age? So 11 to 12 is optimum. And Stephanie mentioned that when the children age out of the Vaccines for Children program and they're above 18, there are other programs available. It's still very inexpensive. So tell us a little bit about the vaccine schedule and the efficacy for people who are older.
As I mentioned before, once you turn 15, once a child turns 15, then it goes from 2 doses to 3 doses. And the 2 doses are on a pretty flexible schedule. The second dose can be given between 6 and 12 months, which is really nice for offices that are doing an annual wellness visit. You could get 1 dose at your 11-year-old visit, and then your second dose at your 12-year-old visit. It's actually safe enough to give down to age 9. The FDA has approved it down to age 9. So some offices give the first dose at age 10. And then when they come back to the office for the second dose, they give it at age 11 with those other middle school vaccines that are due. That's a good way to ensure that second dose is done because you know you're getting your other middle school vaccines, the tetanus and the meningococcal. But then once you hit 15, the immune response really slows down. So you have to get 3 shots once you're 15. And it's, you get one at 0 months, and then you come back in 2 months, and then 6 months. So the earlier you get it, it's only 2 vaccinations. If you wait, it becomes more. But you can receive it all the way up till the age of 26. You can get the HPV vaccine.
Stephanie, do you see many older individuals older than 18 getting the vaccine?
We hit that population with our family planning program whenever they're coming in for an additional service, such as family planning. We hit that population then. We always offer that vaccine on every visit if we know that they've only received, a couple of doses and they need to finish the series up. But we do hit that population with our extra programs that we offer here at the health department, yes.
What about, Stephanie, do you see that you immunize more females than males? Or is it pretty much even across the board?
We do immunize more females than what we do males. There's not a large difference in between there, and I think that it's simply because we see more females come through our family planning program, and we're able to capture those than we do the males. And both females and males are welcome to attend our family planning program here.
Gotcha. So now I have a question for Emily. What if the person only has the first dose? Does that confer any immunity, or is that not?
So the dose or the vaccination is not considered complete, and you are not considered fully immune against the viruses that cause cancer unless you have completed the series. You don't have to restart the series if you miss the catch-up. You can get a second booster dose even if you miss the appointment, but 1 dose will not confer immunity. And once you hit 15, you have to have 3. So 2 doses under 15, 3 older than 15.
All right. I have a question about how Kentucky is doing. This is for Emily, because you work for the State Department of Health, work with them. How does Kentucky compare to the nation, to other states regarding our HPV vaccination rates?
So in the past, we have done pretty poorly across the nation as far as our rates. As of late, our female rates specifically have really come up. When you look at a map on the CDC's website, there are a variety of shades of blue. And if I could show you the map, what's really nice about Kentucky on this map is we happen to be the Kentucky shade of blue. But that means that we are of the 5 groups on that map, from white to light blue to blue, Kentucky blue, navy blue. We're second to the top tier in our women, in our female vaccinations. Where we're really not doing as well is in those males, because everyone associates HPV with cervical cancer. But as I stated before, over 70% of oral cancers are caused by the HPV virus, and that affects men as well. So our young boys at age 11 to 12 also need to get this vaccine.
Right. Actually, the HPV-related oropharyngeal cancer is almost 4 times more likely to be diagnosed in men. So that's, as a dentist, I'm very interested in making sure that that the males are not vulnerable to that as well, because we know that's can be very efficacious in preventing that type of cancer as well. So I think I'd just like to wrap it up with 2 questions, and this is for both of our experts. If you could give one reason why Kentuckians should get vaccinated for HPV, what would it be? Either expert could answer that. If you could give one reason why Kentuckians should get vaccinated for HPV, what would your main reason be?
Well, I can tell you usually what I tell people is it's the right thing to do. Second is I have a child that's in that age group of 11 and 12. People ask me, are you going to give him that vaccine? Well, of course I can. I am only because there's no way that I would be able to look at him later on in life and tell him that there could have been a possibility of him receiving a vaccine and him being diagnosed with cancer. I just never want that, burden put back on me. So I just think that it's the right thing to do. If there's a vaccine out there that can prevent cancers, why not? We do vaccines for a lot of different reasons. Cancer is just another one that we should do it.
Emily, what do you think?
Yes, perfectly said. When I talk to parents, and I do still practice in a primary care clinic about the vaccine, it's the HPV cancer vaccine, and I always message it that way. And just like Stephanie, I have three teenagers. You can see them behind me; they're a little there, but I have three teenagers, two girls and a boy, and they are 13, 15, and 17. All three of them have been fully vaccinated against the HPV viruses. And my son loves to say that he only had to get 2 doses because the recommendation changed, whereas my daughters each had to get 3. So it's a safe vaccine, it's effective. And, if there were a vaccine against breast cancer or lung cancer, I think people would be lining up to get it. Why not get the only vaccine that prevents cancer, which is the HPV vaccine?
What would you say to parents who are listening to this who still have concerns about the vaccine?
The best thing that you can do is talk to your provider. And when I say provider, that's nurse, clinic nurse, nurse's aide, LPN, RN, whoever's giving you the vaccine. Talk to them about what their thoughts are. If you have specific concerns, talk to the nurse practitioner, physician, PA, verbalize why you're worried about it and how they can reassure you that the vaccine is safe and effective. That's the best thing that you can do.
Excellent. Well, I really appreciate both of you joining us today. It's been so helpful. And I really hope that our viewers have learned a lot about HPV and the vaccine and feel more comfortable about it. I agree with you. I see the HPV vaccine as a way to prevent cancer, and Kentucky as a state has the highest rates of cancer in the nation. We also have the highest rates of HPV associated cancer in the nation. Mm-hmm. So this is something that prevents that. It's
yes.
Something that we can.
On that note, actually, I didn't mention before, but that oral cancer has actually surpassed now, the incidence of oral cancer from HPV has now surpassed cervical cancer. It used to be that cervical cancer was the highest incidence of HPV cancers, but it is now oral cancer.
Right. Yet another reason for our boys to get vaccinated. Well, thank you both for joining me. I appreciate
you
much. Have a great rest of your day.
Thank you so much for having us.
So we've talked a little bit about the rates being the highest rates in the United States in Kentucky for oral cancer, the highest rates for HPV-related cancers in Kentucky. But what about Pike County, where we're sitting right now? How are we doing in terms of these immunizations? So if the HPV vaccine has been shown to be effective, it's also been shown to be very safe. Over 170 million doses of the vaccine have been given since it started, I believe about 14 or 15 years ago. But let's see, how is Pike County doing? So I have here the Kentucky Immunization Registry statistics. So you can see this is for 13-year-olds because the target age of vaccination for HPV is 11 and 12-year-olds. So any gender at the top there, 1 dose, and really 1 dose does not confer immunity. You need 2 doses. So about almost 60% of the 13-year-olds, males and females in Pike County, have had their first dose of the vaccine. So that's great. Fewer of our males and females have had the second dose, which is really necessary to have the immunity that that vaccine provides. So you really need to have both doses. And Pike County is not doing quite as well on that. About 40% of the males and females have had their second injection. Now, the thing that concerns me the most on this slide is when you look at the males. So we know now, let's go back to our statistics that we just talked about. We now know that the most common HPV-related cancer in the United States, in Kentucky, is oral and throat cancer. We also know that males are 3 to 4 times more likely to get oral throat cancer. So we need to be vaccinating our males. And you can see that our vaccination rate here in Pike County, we only have about a little over a third of our 13-year-old boys have been vaccinated, compared to about 42%. So there's not too much of a disparity there, but our females are ahead of our males. And so we just wanted to share this information with you to show you that we do have some work to do in Pike County in terms of getting our boys and our girls vaccinated. And so we wanted to show you your county data, but we also wanted to let you know that the HPV vaccine is a way to prevent cancer, and it is accessible and cost-effective and safe. So we just wanted to encourage you to consider the HPV vaccine. If you have questions, you could certainly ask your healthcare provider about any questions or concerns that you have. So just thank you for joining us today to learn a little bit more about what Pike County can do to decrease oral cancer in our area.